help the behaviors. Okay, neurofeedback. What neurofeedback does is it regulates brain functioning from these extremes of too much fastness or too much slowness, and teaches the brain to make more of perfect processing speed, which is the goal of therapists. So what I found, and what has actually led to my full-time practice as a neurofeedback practitioner, is that when neurofeedback is added to traditional therapies, it helps to regulate the brain as the therapist is doing traditional therapy to regulate those areas of the brain. It's a double whammy in getting those areas of the brain online. What does that mean? That means outcomes improve faster and better, which is our goal for kids and for humanity. So when we add neurofeedback, we can really get the biggest bang for our buck out of both of them. So when people join me for neurofeedback therapy, I ask them if they have the appropriate therapies in place, and if they don't, I encourage them to do so. Okay, neurofeedback is based on Pavlov's dog, which is classical conditioning. So it actually takes classical conditioning. Pavlov rang a bell and the dog salivated in the presence of food. Neurofeedback takes that one step further, and it's called operant conditioning. And I have other videos on my YouTube channel on operant conditioning if you'd like to check them out. What operant conditioning does is it creates a feedback loop, a positive feedback loop for positive change. So when we adjust brain functioning to perform better, then kids have better behaviors. What do better behaviors get them? Better outcomes. So when their outcomes improve, that is actually a scientific law. Hebb's law says that improvement in behavior and outcome will make the brain pattern wire itself in harder so that you can rewire a brain to be able to perform better permanently. So Hebb's law states neurons that fire together wire together. And that is what we are trying to do through neurofeedback and traditional therapies. And that's why they work together so well. So you can see how it works with this idea of the feedback loop. So when people have neurofeedback therapy, their brain is receiving feedback auditorily and visually when their brain is in the zone. This teaches the brain to make more of perfect processing speed and less of too fast and too slow. Then they go out into the world and have better behaviors and better outcomes, which then encourages that brain to keep rewiring itself in as we continue to rewire it in through neurofeedback in the office. And then those changes will become permanent and neurofeedback will not be necessary long term. You may or may not know this, that neurofeedback therapy is endorsed as a level 1 best support for kids that have this slow processing, too much theta brain map. Kids with ADHD, with learning challenges, and you've just seen kids with sensory processing disorders have this same type of map. Kids with speech and language disorders have this same kind of map. Those maps are all very similar, just in the different areas of the brain. And the reason this slide is important, and clearly you can't read that, but you can look this chart up online, and it's right here, level 1 best support for ADHD and hyperactive behaviors. The reason it's a level 1 best support is because there's so much science that proves that it works, and that it works permanently, like I just told you. And there's so much science that in 2012, the scales tipped in the American Academy of Pediatrics started endorsing neurofeedback, which is totally awesome because then more people are going to take advantage of it and get themselves well faster. But the reason it's a level 1 best support is because it works. So in the office, we see lots of people with many different types of brain maps, but this is the easiest map for us to shift. One of too much slow processing speed. It comes down, 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 and especially kids, they just get better, better, better over the course of their treatment plan. And especially if you add the other therapies in where the child's actually learning those skills that they may not have picked up on because their brains were running too slow, now you have a double recipe for success. Okay, so what to do in the meantime if kids you're working with or your own child isn't having neurofeedback therapy? Number 1, I call it the Purge and Reboot. So Purge means you have to figure out what the behaviors that your child is doing. What do those behaviors mean about their brain functioning? And of course, if you don't have their brain map, you're going to have to hypothesize. But like I just told you, if you have a kiddo who's sensory seeking, their brain is running slow and they're trying to stimulate it. If you have a kiddo who never stops talking, it's either that they're running too slow or they're running too fast. So you want to see what need that behavior serves to the child's nervous system, and then you want to help them take care of that need, opposed to getting rid of that behavior. You can't get rid of the behavior until the need is gone. So it's not something you can do overnight. You have to shift the brain so it no longer has that need while you're trying to, that's the reboot part, while you're trying to purge the need for the behaviors. So you can find more appropriate ways to serve the need of the nervous system, opposed to just letting that need take over the child's behaviors. And if you follow me on social media, you know that something that I say all the time is control your brain or it will control you. That's an example of when a behavior is just, misophonia is one thing, where if a child can't be around their parent and their siblings, that misophonia is just driving the family. I have families who, before they did neurofeedback with me, couldn't drive in the same car on vacations. Everybody had to drive separately, could never eat at the dinner table together. So, you choose your battles, but you find a way to make those things tolerable and acceptable while you're rebooting the brain. Okay, so, and you can do this within therapy sessions too. So any good therapist knows that you want to have a strong response to intervention within the therapy session, and you want to build a therapy session so it peaks with the ability to challenge the child's nervous system in the middle, and then at the end of the therapy session, let them leave on a win. That's how we set up the positive feedback loop. You can include these brain-based scientific strategies so that you're taking brain functioning into account in your therapy sessions and across your therapy sessions also. Electronic screen syndrome. Kids need to be taken off their electronics at least an hour before bedtime. Electronics jack up the brain. And I have a whole half-hour seminar on this topic, but wired and tired electronics make the brain. So moderate them, and don't let your kids go on electronics right after their therapy sessions, neurofeedback or any other therapy. Let their brain integrate what they just learned in their therapy session. Don't wire and tire it through electronics. Use those electronics sparingly. And I have 6 children, so 5 of my kids are school age. I totally know this electronic battle. It happens on a daily basis. Sleep and nutrition. Sleep is one of the number one factors that can help to reboot a brain. And if your child has difficulty falling asleep, then you may need to give them more time to come down. If you try to take the electronic piece out of the equation before bed, that'll help your cause, but you need to help your child get as much sleep as possible so they can be and stay regulated throughout the day. And nutrition, again, I have a whole nother seminar on nutrition. Anytime the body's dealing with a toxin, and yes, I would consider Doritos toxic, even though they're delicious. I had a couple Cool Ranch Doritos the other day, and I don't eat them frequently. I'm like, these things are delicious, but anything that's not all natural, your system has to use more energy to deal with. So just keep that in mind when you're letting your kids drink soda. Soda means their system has to deal with soda, not just keep itself regulated. So keep that in mind, and you really should seek out more help in the nutrition area from someone who knows how to guide you if you don't think you have nutrition in check. Okay, so what can we do today? Recognize that symptoms come from the brain. That is where they're coming from. In the first slide, the brain is the supercomputer of the mind and body. That is true. I'm just the messenger on that. So if there's challenges that your child is dealing with in those areas, it is coming from the brain. It's proven by science. You can go on my Leigh Brain and Spine website and see scientific articles that say that the brain patterns that I just told you are the brain patterns that cause those different challenges. It's coming from the brain. Number 2 is there's a very inexpensive app that you can get on your phone. It used to be free. Now I think it's $1.99. It is not neurofeedback, but it is something that's called audio entrainment. So it's binaural beats. So when you can listen to your own music, and behind it are sound waves that are basically vibrating at the frequencies that I just showed you. So you can choose which frequencies your system needs more of, and you can put that frequency into your ears and your brain will attune to that frequency. So if you need to chill more, if you're wound tight and you're running hot, then you want to use one of the selections that increases alpha, your ability to be calm. Or if you have difficulty sleeping, you could use it before bed and boost theta and delta so that you can get and stay into sleep. So check it out. It's a very inexpensive way to start thinking about my brain, and my brain speeds are controlling my behaviors, and now you have a tool to do something with it. And lastly, if you are a therapist, you really should encourage your patients to have a qEEG brain map for their sake and for your sake. It will inform your practice. You will know how their brain is performing. It is like an x-ray of the brain. Would you ever go and have your leg set in a cast if you thought you broke it without getting an x-ray? No, you'd get the x-ray so you knew exactly if it was broken, exactly where, exactly how, so you know exactly what to do about fixing it. That is how I feel about brain maps. Every therapist should be encouraging their patients to have a brain map. In our office, we offer a brain map screening for $99, which is incredibly affordable. It is not a complete map, but it gives a snapshot of brain functioning so the therapist or the parent knows if the brain is running too slow, too fast, too much medium speed, which is depression, and basically the overall functioning of the brain, just to get a picture of what's happening. I would encourage everybody to get a full map, but sometimes that's